this series on Monday, on the 9th of October, which is the start of Play in Hospital Week. So the seminar today, the webinar, is going to focus on the task force on children's play in healthcare, which has been led by NHS England and Starlight. A huge amount of work has taken place over the last year, with lots of support from colleagues in the sector, and especially from NAPS and HIPSET colleagues supporting this work. And I hope you find today's presentation interesting. It's really important work, which is going to support systemic change within the whole healthcare system to ensure that play is recognised and valued for what it can contribute to children's healthcare journey. We want to be supporting integrated care boards to make the right decisions when they're commissioning services for children, to make sure that play features in those commissioning arrangements. We've done a lot of work around reviewing what standards look like. What does good quality play actually look like, to try and get to some agreement around that, so that everybody can aspire to achieving those standards. And of course, very importantly, there's been a lot of work around developing and supporting the workforce in this sector, because without them, nothing is possible. So I hope that you will find this presentation interesting. There are opportunities to ask questions after each part of the presentation, and we aim to finish in an hour's time, and I promise we will do that. So I'm now going to hand over to Adrian, and I very much hope that the tech works, because I'm going to mute myself now. Thank you. Over to you, Adrian.
Thank you, Kritika. I hope everyone can hear me. You turn your volume.
Yes.
So.
Adrian, come.
Sorry, hang on a second.
We're in the same room, so we...
There we go. Our coordinator is looking after her little boy today, who's not very well, which is why we're scrabbling slightly at the last minute around the tech, but we'll get there. So welcome everybody, and as Kritika said, this is about the task force on children's play in healthcare. First of all, just not to assume that you all are familiar with Starlight. Very briefly, we are the national charity for children's play in healthcare. We support children to experience the power of play during their treatment, care and recovery. We work in more than 600 healthcare settings across the UK. And we're also working to advocate for policy change, systemic change, to raise the profile of play and the importance of play within the healthcare system. We are an evidence-based charity. All of our services and our policy advocacy work is informed by research, our insights and impact into the efficacy of children's play and how it works within practice. And most importantly in that research is listening to children and young people. And what children and young people tell us about being in hospital after all these years is that it's scary. That's overwhelmingly the dominant thing that children tell us. This was a survey that we did across the NHS this summer. Play makes it better. They want us to talk to them and not just their parents. They want relationship and they want kindness. What would make it better? More play specialists, more resources, more play resources. One of the most popular responses. This young man, Mackenzie, was a member of the task force, a very constant member. And this is what he told us. When he was younger and on the wards, he struggled at the weekends because there were no play specialists to help him with his operations and cannulas. They weren't there. He'd struggle. He wasn't sure what to do. And he joined the task force because play specialist was one of the things he wanted to help to change the profile and the importance of children's play to people like him in healthcare. So Starlight's policy aims, just want to put this in context. This is the planned spend for the Department of Health and Social Care in the current financial year, or rather the last financial year. According to the King's Fund, £180.2 billion. I just want you to bear that figure in mind. This is the child population of the UK as of 2021. And these are the statistics, some of the statistics that we've derived from a Freedom of Information request. We've state of play across the NHS, and these are some of the figures. Excuse me. 1.8 million hospital admissions for children in the UK. Only 571 registered health play specialists employed to support those children. Only 50% of settings have any kind of policy guidance for children's play. 71% have no budget. Could I ask everybody to please mute? Thank you. 95% use Starlight services, which are free to the service provider. So Starlight's policy aims are, first of all, that play services should be fully reinstated. They went backwards after the as a result of the pandemic, and we want play to be at least restored to pre-pandemic levels. But in the longer term, we want health play specialists to be recognised as an integral part of children's healthcare. We want there to be national practice standards for health play services, national guidance and service specifications to make sure the funding is there. And all of that should lead to adequate levels of health play provision and sufficient numbers of health play specialists. In a nutshell, better recognition for health play services, better standards for health play services, more and better supported play staff. These are our aims. So how the task force came about was in formulating those aims and consulting with many stakeholders. We had a long conversation with NHS England and found that they are in fact very receptive and very open to working with the sector and with Starlight, because their commitment is that they want all children, young people and families to have their voices embedded at the core of their work. There is a transformation programme which is part of the NHS long-term plan, and they want to work with anybody that can help to inspire the change to make the patient experience for children and young people better. So there was an open door at NHS England, which was most encouraging, and within a few weeks we had agreed with them to set up this task force to explore what could be done to raise the profile, raise the status and improve the capacity of children's play in healthcare. So this task force was formed during the sort of summer to autumn of last year. It was announced at the NAPS conference in June 2022. And it was devised like this, with an executive group that consisted of Starlight and NHS England jointly chairing the task force, and with the support of the two professional bodies, NAPS, National Association of Health Play Specialists, and HPSET, that's the Healthcare Play Specialist Education Trust. The RCN joined, Sophie's Legacy, the independent charity, joined, NHS Youth Forum, St Louis Mackenzie, the Care Quality Commission, and the Royal College of Paediatrics and Children's Health. So very important stakeholders on the executive group. And the structure was to have 3 different work streams, looking respectively at accreditation and workforce development, national guidance for commissioners and trusts and other providers, and national standards for services. They were all chaired by a member of the executive group. and it was an intense schedule of meetings, 4 meetings per month, one for each work stream, each of them reporting into the executive group every month, 60 members or more in total. 2 consultants and a special advisor were employed, many external bilateral meetings, and all of that resulted in us being able to report our findings and proposals to the NAPS conference exactly a year after the original task force announcement. My colleague Irene, who you will hear from in a minute, often called it a fast-moving train. I'll leave you to decide who was who in this picture. The results and the output. So this is what we presented to the NAPS conference in June, and this work is continuing to progress. So first of all, national standards, and just to clarify, these are service standards for service managers and service and practitioners, but not to be confused with the professional occupational standards, which are the individual standards for health place specialists. These are standards for the whole service, and it is the service managers and the service provider, the trusts, that will be accountable for these standards. We want services to adopt an essential commitment that they recognise the right and the need of babies, children, and young people to be supported by specialised health place staff and resources as an integral part of their care and treatment, and that this is an essential component of what they're able to experience in the setting, and that they make a commitment, therefore, to uphold the national standards. So this is like a promise that we're inviting settings to adopt and to make this commitment to their patients. The standards themselves, these are proposed standards. There will be further consultation on these before they're fully adopted. There's 8 standards. The first one is that there is a clear policy and that play is promoted across the whole service, that all babies, children, and young people have access to safe and appropriate resources, play resources, while they're in the setting. I'm going to use the shorthand children to imply all babies, children, and young people. So children who spend significant time in the setting have consistent play sessions, facilitated play sessions. All babies, children, and young people have access to play services, including registered qualified play specialists. Play is recognised and advocated for by all members of the multidisciplinary team. There are safe and appropriate play resources available to all children who visit the adult services, as well as being in paediatric care. The healthcare environment is playful, welcoming, and accessible. And that all the staff are trained and qualified to the recommended level and registered with their professional body wherever relevant, and supported in their continued professional development. This is a key issue that Irene will touch on some more in a moment. So alongside the standards, there will be an audit tool that enables the setting to evaluate and assess their own service against each of the standards with a whole range of indicators and measures in order to be able to assess how well they're doing in terms of fully meeting the standard. But for example, this one, standard 4, which is about the availability of play staff, they won't get a full green as in fully meeting the standard. So you see it's a RAG rating system. Full green means sufficient play staff are available to inpatient wards 7 days a week. One of the things that children have told us most is that they feel abandoned at the weekend, like the quote from Mackenzie earlier, where there's often, in most places, we believe there's no service at the weekends. So that's very important. And each of the standards will have this RAG rating system that allows ongoing audit, assessment, and identification of priorities for improvement. So that's the standards, and we thought we'd break after that session to allow for questions and comments. I've given you a lot of information there. I'm just going to stop sharing my screen for a moment and see if there are any questions. Questions about the standards, or indeed the structure.
Yes, Gemma, would you like to unmute and share your question? Or you can put it in the chat, whichever's easier for you.
Yeah,
Thanks.
I'm about to mentor students for the first time. I'm just wondering whereabouts are these standards at, so like the national standards, so we can have a read of them.
Good question. They're not published yet. This is work in progress. They will be published by NHS England, we believe. That's our current understanding, sometime over the next few weeks or possibly months. So you're hearing it hot off the press here. This is work that has just been completed, and this work is all going forward now to NHS England. The principle is that if Starlight publishes them, they're not going to carry as much weight or have as much exposure as if NHS England adopts and publishes them as official standards. So that's why we're playing the long game. We're being patient. We're working with NHS England on the basis that they will eventually publish them, but you can understand that might take a little bit longer than if we publish them ourselves. But they will. The current understanding with NHS England is that they will publish them for a consultation period, so everyone will have a chance to really look at them, really explore and investigate how suitable they are, and then feedback into that process, what the how they work for you, and then there will be a revision, and then final official standards will be published probably sometime early next year.
Okay, thank you.
Thanks for the question. Any other questions?
Yes, we have a raised hand from Karen, so I'll hand over to her and then I'll read out some questions that we have in the chat. So Karen, if you'd like to unmute.
Oh, hi again. Some excellent work on there. So I'd just like to say that first of all. And I have asked this question again. Is there any update about the evolved nations, Scotland and Wales? I know this you started in England again, but is there any talks? Somebody said before there was talks about the devolved nations getting involved.
Thank you for the question. It's a really good question. Starlight is a UK-wide charity, and so in principle, we have every intention of doing equivalent work in each of the 3 devolved nations of the UK. Currently, healthcare provision is a devolved power, and this is very intense work, and we have limited resource. We're very focused on England. We want to get it right in England. In the longer term, we very much intend to have those conversations with the equivalent NHS institutions in each of the 3 nations. And we believe, although we won't know until we actually really join those conversations, we believe it will be easier because of NHS England having essentially established a precedent. But that remains to be seen, and that work still has to happen. So we're going to complete this work, get the standards, get the guidance published in England, and then we can really start to focus on the other 3 nations.
Okay, lovely, thank you.
Thank you, Adrian. There's a couple more questions, so let's cover those, and then I think we should probably move on in the interest of time. So the next question in the chat was also about devolved nations, about Scotland, so there's a lot of interest in that. The following question was from Savitri Fernandez, who I think has now put her hand up. So if you'd like to unmute and share.
My question is that in the policy is aimed at the hospital play specialists, but in our hospital we have only got 1 qualified hospital play specialist at the moment, and we got more play workers. Could they be included in this policy play workers as well?
Oh yes, just to be really clear, this work, both standards and guidance, is for the play service. We're not trying to replicate the work of HUPSET or NAPS, the 2 professional bodies for health play specialists. What we're doing is we're working with NHS England to produce standards for the whole service that will include advice and guidance on the composition of a health play team. That will ideally include health play specialists and play workers. hospital play workers as part of a whole team. So you're absolutely included in this. This is not guidance for health play specialists, it's guidance and standards for health play services in the round.
Thank you for the question. And the next question we have is from Chantal, who said that in the standards you're talking about inpatient wards, but what about daycare, assessment units and outpatient areas, which are just as important?
Yes, in the guidance, it will be looking at the whole of the healthcare system and the role of health play services in supporting children wherever they might be within the healthcare system. So we absolutely take that one on board, and that will be in the guidance.
Okay, thank you. And then the final question we have is from Leanne. So Leanne, if you'd like to unmute and share.
Hi, sorry, you may have already covered this, but I work in the community, so I was just wondering, is the community also going to be involved with that as well?
Very much so. As I said in answer to the previous question, the guidance is going to cover the whole of the healthcare system, including community care. I mean, there is a question of priorities for the NHS, of course, and we're not obviously responsible for how those priorities are considered and what decisions are made in terms of allocation of resources. But as far as the actual concept and perception of what health play services are for, they're really about following the child and providing the appropriate level of support through health play specialism, through health play work to children wherever they might be in the system. That is the concept, and that is the principle of the work that we're doing.
Thank you.
Okay, great. That was all the questions. So I'll hand back to Adrian. If you do have any more questions, please just put them in the chat and we'll cover them in the next Q&A segment. Great questions. Thank you very much. I'm now going to introduce you to Irene O'Donnell, who's a special advisor to the Taskforce, very experienced health play specialist, and she's going to talk to you about workforce development. Irene, just tell me when to move the slide on, Irene, and I will do that for you.
Thank you, Adrian, and good afternoon, everyone. Lovely to be with you this afternoon. And I apologise in advance if there's any tech issues my end. I've had to switch locations as I'm on site on my NHS role today, so couldn't get the tech to work in the other room. So let me know if you can't hear me or there's any issues. So I think what's important to start off with is that the three pieces of work, the workforce, the guidance and the standards, form a triangle and scaffolding. One doesn't work without the other. And I think sort of the questions that have just come up for the standards are so potent and really important, because actually without the workforce, we can't deliver the standards or the guidance. It's a chicken and egg, quite rightly. So we need to get all of those right. And the workforce is very much encompassing the entire play healthcare workforce, from whether you work in the community in a young person's home or in a hospice setting.
Available on the website.
Sorry, is it possible for everyone to keep themselves on mute, if that's okay? You know, right through to those daycare outpatients and inpatient wards. So it really is representative of the workforce that we have and we value, and we need to continue to grow. Next slide, please, Adrian. So as part of the workforce subgroup that I chaired for the task force, we had a monthly meeting. It was lots of different people that were representing how we wanted to look at the issues that we all have as part of the workforce, and these were the ones that came up as an agreed focus for what will form the workforce strategy going forward. And that was to grow and develop the health play workforce. And the language that we're using is really deliberate and mindful. It's not about hospital play specialists only or healthcare play specialists. It's about our play worker workforce that are very much part of an integral part of the team. And also about healthcare wherever that child or young person receives it. And to recognise and sustain equal professional status, and that's for health play specialists and play workers, and looking at how we can do that through appropriate training, but also guidance and standards around what good looks like. To resource the healthcare health profession with the right skills and qualifications. I think that many people that were part of the group that I chaired talked about the challenges with accessing training. It's a bit of a geographical lottery, I think, is one term that came up. So, for example, our colleagues in Scotland and Wales might have less access than if you are based in the southeast of England, for example. So we're trying to look at ways that we can make it more sustainable and accessible. And future-proofing our workforce. You know, mentoring is a really good example of this. We know that we have to grow our future workforce. We need mentors, but we listened really attentively to our colleagues who were saying that, you know, mentoring is really difficult on top of everything else we have to do, or the process. And, you know, and from that, we've really been able to take steps to make things more attainable for everybody. Next slide, please. Thank you. So some of the, I think, successes that are worth highlighting and celebrating that we've managed to achieve in a relatively short space of time with mentoring. We have helped with the process of being a mentor by having two people that can share that role. So you have a named mentor, but a supervisor. So we've worked really closely with HEPSET to try and figure out how we can support health play specialists to be mentors and really do some good communication around, you know, why it's so important and how and what people need to make that more attainable. So HEPSET have a series of mentor training that I think some of it was run just last week, and there's more support going forward, and that's come directly from listening to practitioners about how we can make this process more supportive and make it more appealing. We are working towards something called PSA, the Professional Standards Authority. So as most of you know, HEPSET, we have a mandatory voluntary register for healthcare play specialists. So most people, it's sort of it's not really an option not to be registered in your trust, but there's still places where people don't recognise that you need to have qualified registered health play specialists, and this would be a way for us to attain a more mandatory registration in line with all our other healthcare allied health professionals. We've been able to work really closely through with Kate Pye and her colleagues at NHS England on creating a sub-page on the future NHS platform, which means that we have a one-stop a community of practice where health play staff can obtain lots of information about training, such as these webinars, about updates, about asking those professional questions. You know, how can I support a young person who's having a PICC line, for example? All of that is being created, and some of it is live already on the future NHS platform, and all you need to join is an NHS email. So that's something we've been able to achieve. We've been able to do a supportive rejoin the register for the lapsed HEPSET health play specialists, which has been a really, I think, positive piece of work. So instead of people feeling that they've let their registration lapse and the process is too difficult to come back, we have done a call out to everybody, and there's been a really good response, and we've been able to enable people to get back onto the register that had let their registration lapse, so made it a more supportive process. And then finally, with NHS Careers, next slide, please, Adrian. It feels like sometimes the small things are the big things. So we have historically been on the NHS website under corporate services, which was very random, and actually was because I don't think they knew where to put us. So we managed to link in with the right person to have that conversation to move health play staff into clinical support staff, which felt like a really big win for us, even though it might feel like a really small thing. It's about status and identity and professional recognition. So that's been something we've been able to do over the last few months.
Thanks very much, Irene. So any questions or comments about the workforce stream?
So there's one question in the chat, which is, are you going to join up with HEPSET as a professional body?
If that's a question to Starlight, absolutely not. Starlight is a children's charity, not a professional body, but we work very, very closely with both HUPSET and NAPS, which is the other professional body. But Irene might say something about those two different bodies and the relationship that they have and what's happening there.
Thanks, Adrian. So yeah, so as again, many of you might know, but for those who don't, HEPSET and NAPS are merging into one organisation called the Society of Health Play Specialists, and that process has been a long process because it's a legal process for two charities to merge and form a new charity. And again, that's come from listening to our profession and colleagues, and there's a lot of confusion around who's the professional body, who's the, you know, who does what, and actually we're stronger together. So that process, we're hopeful that it will come to fruition by the end of the year. We're really close to that now. So that will be the one-stop shop for your professional body and your professional register and training and everything sort of under one roof and under one profession. I think what's important to sort of point out as well is that very much exploring how health play workers and health youth workers, who are our other colleagues who work really closely with, have a place in that if they want to. They're very welcome, and we're being very mindful about the language you use in the guidance and in the workforce strategy around our colleagues who work alongside healthcare play specialists.
Thanks, Irene.
Great, thank you. The only other question has been answered by Krutika, but I will just share it in case anyone can't access the chat, which is someone was having difficulty hearing the webinar. So the answer to this, not that it's really a question, is that the webinars will be published on the Starlight website soon at a later date. We can try and arrange for the usual coordinator who runs these meetings to maybe send an email prompt once they've been uploaded, just so that you're aware when that happens, because I realise uploading soon is not a great answer. Other than that, there are no other questions, so I'll hand back to you, Adrian.
Thank you very much, Erica, and thank you, Irene. So the final work stream, not that there was any priority order, they all worked in parallel with equal focus, but the work stream I'm going to talk about now is the one that focused on guidance. So when we say guidance, this, just to really make clear the difference in standards. Standards are what we want health play services and their settings to adopt as a standard for that service. The guidance we're developing is really aimed at the high level commissioning process and the NHS Trust decision makers, because it's about recognising the importance of including health play services in the commissioning process, so that service design and crucially the resources that are needed to grow this part of the children's healthcare sector will be unlocked through getting this guidance right. That's the aim anyway. And just to acknowledge the role of Kath Hubbock in doing the research and drafting. Kath was a consultant to the task force before she joined Starlight on staff. I'm happy to say she's now a member of our team. So the context for the guidance is that NICE guidance, and if you're not familiar, I'm sure most of you are familiar with NICE, but just not to make any assumptions, NICE is the National Institute for Health and Care Excellence. It's the official advisory body for the whole of the NHS, government mandated institution providing best practice advice based on the most up-to-date research evidence. And what it says about children, babies, children and young people's experience of healthcare is that providers should be providing an environment that supports easily accessible, age-appropriate play and recreation for all children and young people, because it reduces boredom and anxiety. And also crucially, and this is the area that's more often overlooked, we have found, it reduces the fear and anxiety about pain that children experience during procedures and interventions. Using therapeutic play and distraction techniques can create a calm environment before, during and after those procedures. So the guidance from NICE is already there, recommending as best practice that these services should be available to children. So the aim of the guidance that we're developing here is how to make sure that trusts and commissioners know what the implications are of that high level NICE guidance. What does a play service look like? What should it be aiming to achieve? How will the service be best constructed and managed? So the broad aims of a play service, according to the guidance that we're producing, will be to provide play opportunities for all children, play services for children that need particular care, and play-based interventions for children who need specialist care. And this is modelling what is a current model within the NHS called the Comprehensive Model for Personalised Care, which identifies there are certain universal needs that the whole population has. There are certain targeted services that people, and in this case children, with ongoing conditions have, and then there are specialist interventions that children with complex or complicated or specialist needs require. And the model that we want to propose for health play services is that it fits within that much wider overarching model for the whole of healthcare. We want the guidance to improve patient experiences, to reduce treatment or recovery times, to improve the efficiency and flow in their services, because children who are not so anxious will be more engaged and therefore less resistant to treatment. And crucially for us, and this is the bottom line, it will reduce trauma for children. Improved participation and agency of children is another way of saying it will reduce their trauma, because children who have more control, more agency, are more engaged, more participative in their own care and treatment, are less likely to be traumatized by it. We want the guidance to provide clarity about the importance of play, about its role in trauma mitigation, but also crucially about the range and definitions of the roles within the health play workforce, and about the scope of the service across all of healthcare settings. That's in answer to one of the earlier questions. We really are covering the whole of the healthcare system. Wherever children access a service, there should be a proportionate level of support from the health play workforce. And this is how the model looks. As I said, it's based on the personalised model for universal healthcare that was published by NHS England in 2019, where you see that the largest triangle is for the whole population, universal play opportunities for children who are engaged in any healthcare at all, predominantly at the primary care level. And then you have the pink triangle, which is for children who are accessing secondary and tertiary services. And the small triangle at the top, these are children in specialist care. And there is an equivalent level of support at each of those levels, universal, targeted and specialist, all leading to those outcomes for children. What does good look like? And this is the $64,000 question, because how is a trust going to design its service? What are commissioners going to say about what service design should look like? And of course, it has to be according to context. So there needs to be a consideration of the acuity of the patient demographic that the service is for. There needs to be an assessment of the needs of patients within that setting. There should be an ongoing audit of the existing provision in order to identify gaps and priorities for improvement. There needs to be a consideration of the composition of the wider multidisciplinary team, because capacity of the overall team is important. Health play practitioners are not working in a vacuum. They should be part of the overall MDT. And there should be an assessment of the impact of the particular environment on children in that setting. So all of those different things should lead to a consideration of service design that will determine what the team composition should be and what the staff ratio should be. And clearly, it's a different ratio according to the outcome of that overall assessment, and will depend where the child is on the pyramid that we just looked at. So that's the guidance. Any questions or comments on the guidance? And another whirlwind tour through, so do take a pause and think about if you have any questions.
Yep, so we have a hand up from Karen Thomas, if you'd like to unmute yourself and share your question.
Oh, hi. Just it came up there, staff ratio. What sort of, have you looked at staff ratio at all, or?
Yes, this is something we're always looking at because it's a key issue. And I don't want to preempt what NHS England will eventually settle on in terms of what, because just to remind you the context of all of this work, this is a partnership with NHS England where Starlight has taken a lead on engaging with the sector to really find out what the sector says good looks like. You know, what are the needs of services from the point of view of all the different stakeholders we've spoken to, but ultimately it will be for NHS England to determine what it wants to publish as guidance. So these are our best recommendations, and it will be about, rather than a fixed prescription, it will be based on an assessment of need according to that model that we've just shared. But we do know that historically there has been a 10-to-1 ratio recommended, and we think that that might feature in the guidance, just referencing that historical ratio, but also recognizing that children with complex and needs for specialist interventions may very well require a greater ratio. Those wards and those settings may require greater practitioner to patient ratio. Children in maybe community settings, maybe a lower ratio. But we also do know that there is a reluctance for NHS England or any of the national institutions within the NHS to be prescriptive in terms of numbers, because priorities are tight. Priorities are a real issue, resources are tight, and it may well be that NHS England doesn't name any specific ratio, it just provides the model, because ultimately funding decisions are made locally. They're made by integrated care boards who issue the contracts, and then by the providers, mainly the NHS trusts, on how they allocate those resources. You know, the honest answer is it remains to be seen what NHS England will say about ratios, but we're giving them our best advice.
Oh, amazing. Thank you.
Thank you.
Thank you. There's no other questions so far, but there are a lot of compliments, so credits
well, that's
to
very
you.
nice. I do have a few more slides just to talk to you about what's going to happen next. So I'll move on to them now, and then there could still be some Q&A after this if anybody has any further questions. Well, that was a mistake. I didn't mean to go back to the start. Bear with me. So I want to talk to you about next steps. Slide. So all of that work's been done. We have draft guidance, we have draft standards, draft audit tool, and we're working on the workforce development strategy. So the next steps are that NHS England will publish these documents for a public consultation. So anybody that hasn't had a chance yet to contribute can have the chance to do that. And we would invite you and all of your colleagues, if you haven't been involved in the task force up to this point, to look forward to that consultation and really read the documents and really talk about the documents with your colleagues, with your managers, and within your peer group, within the sector, and tell us your honest opinion of are they the right standards? Are they viable? Are they achievable? what are the potential barriers, and any suggestions for how they could be improved will be very welcome. Same with the guidance. Are we telling commissioners the right things? Is it credible? Is it persuasive? Have we missed anything? Tell us what you think, because the executive group is committed to looking at the results of the consultation and then making any revisions that we decide would improve the documents before we finally hand them over to NHS England for a publication as official standards and official guidance, probably sometime next year. We're going to be looking at reviewing the service specifications that inform the NHS mandatory contracts to try and make sure that health play services are properly referenced within those service specifications. If you're not familiar with what we mean by service specifications, these are the templates that basically populate the mandatory NHS commissioning contract. Because it's a statutory service, the contracts are all a legal requirement for the trust to issue a certain form of contract, and there are specific service specifications for different types of health service that they are issuing the contracts for. So we want to inform that process and try and make sure that health play services are properly included in the contracts where they should be. And the workforce development strategy, Irene is working with us to form a group that will carry on the work of the task force moving forward to develop a strategy alongside NAPS and HUPSET, or the New Society, as they merge, and working also with employers, with NHS England, who have an overarching workforce development strategy that you may have noticed was published in the summer by the government, to ensure that the health play workforce is included in that work going forward. So all of that work is ongoing, and sort of watch this space. And just to say, we are ourselves about to publish a report, a written report of all of this work, which you will be able to download very soon on the Starlight website. It just remains really to say thank you to everybody that contributed to the task force, more than 60 professionals in total. We couldn't have done it without them. It was a lot of work, a lot of people giving up their time during their very busy schedules, and we are incredibly grateful. Many of you are here today, so our heartfelt thanks. And that's it really, unless anybody has any further questions in the few minutes remaining.
Thank you, Adrian. We immediately have some hands up, so I will pass over to Amanda Williamson.
Hi there, thanks for the presentation, it's been really good. Only one question I really wanted to ask was, you mentioned about this consultation, will that go out to everybody, or will that just be for those in England?
It will be a public consultation, so there won't be any boundaries to who can respond to it, but it will be NHS England who are working with us on how we respond to the consultation. So it's sort of yes and no, really. It's a public consultation, but it's a consultation on work that is happening in England. We need to be clear about that. That's one of the consequences of devolution, is that if you want to develop policy work in a particular area that is a devolved power, you have to do it one nation at a time, unless you're a much bigger charity than we are. But we are very hopeful that we've had some preliminary conversations with colleagues in each of the other three nations, but we just do not have the resource at the moment to work in parallel, working with big national institutions like NHS England in 4 parallel streams. So we have to stay focused, get this work completed in England, and then we will, as I said earlier, move our focus to the other 3 nations.
Thank you.
Thank you, Adrian. The next question we have is from Karen.
sorry, it was exactly the same question that was asked previously. But I just want to say I've been in the field a long time and it's very exciting times, and I just hope, you know, that everything comes to the other nations and stuff as soon as possible as well. Thank you.
Thank you. I mean, what I could say, maybe in addition to what I've already said about the other three nations, is that, you know, advocacy can go a long way. And, you know, those of you that are involved in the community of practice in each of those other three nations, the more that you make representations to whoever you would need to within the NHS in each of those, in your own nation, then the more chance is that when we are ready to move our focus into those nations, the more receptive they're likely to be. So it's not entirely down to Starlight either. I mean, these are systemic changes within the NHS that we're advocating for. And, you know, we don't own this. We own the work that we're doing, but what we're talking about is systemic change within public institutions and within a very important public service. And so, you know, the work could very well, in theory, happen without us. But for our commitment, we need to focus on getting it done in England, and then we will move and see what we can do and build those alliances and build those networks to advocate for change in those other three nations as well.
Thank you, Adrian. And we have one more question in the chat from Savitri Fernandez. I apologise for the pronunciation. And she wrote, "Thank you. We did not know all of what you spoke about, so she will now feed back to the rest of the team. How can we see the draft?"
The draft guidance and standards will be published in due course by NHS England. And I'm not trying to be coy when I say in due course. You will understand, I hope, that the NHS England is a huge public institution, and we decided that these documents would have far more power and influence and reach if NHS England were to publish them. The cost of making that decision is we have to be patient. You know, NHS England will publish them when they're ready, and I can't speak for them. We hope it will be quite soon. The work is done. The drafts have been submitted. They have to go through quite a lengthy approval process, and then they will need to be coordinated with whatever else they're publishing, and, you know, what announcements they're making and when, and what the Department of Health wants, and so on and so forth. So we do have to be patient, I think, but in good faith, we have a very close relationship with NHS England, and we believe the guidance and the standards will be published soon.
Okay, thank you. Kritika, I just muted you for a second because it was echoing, but you can unmute now that Adrian has muted. There are no more questions as it stands, but there are a lot of thanks to both Adrian and Irene for sharing the depth and level of information they have. So thank you on behalf of the attendees. And if there are no more questions, which it doesn't seem to be, I believe we're handing over to Kritika to wrap things up.
Thanks, Erica.
Thank you. Can you hear me?
Yes.
Yes, great. Thank you so much. I'm just conscious of the time. We promised we would finish on time. We've got 4 minutes. I just wanted to say a very big thank you to Adrian and to Irene, but particularly to you, Erica. Thank you for stepping in and just making sure that everything went smoothly. Technology is always a challenge, but it's brilliant when colleagues step up and just make sure that things are done. So thank you so much. That's fantastic. I hope that we all learned a great deal from that webinar. As you can see, it's a very ambitious programme and can have a significant impact on the way that children experience their healthcare journey. So please be advocates for everything we're doing. Read our reports. There's lots of information on the Starlight website. A recording of this webinar will also be on the Starlight website. as are the recordings of previous webinars. As Adrian said, a report about the task force is about to be published within the next couple of weeks, so look out for that. And as we enter into Plain Hospital Week, we will Starlight will be publishing its annual report on some really interesting work as well. So that will be published next week. So please do visit the Starlight website. There's lots of very useful, interesting information, and keep talking to us. This is an open dialogue. We are key players in this space, but we definitely don't have all the answers. We need to be challenged and supported by all of you in the work that we're doing. So thank you very much for attending this webinar, and I hope to see some of you next week at our final webinar, which is on Monday, the 9th of October, and I hope that you will have had received invitations for that. So thank you very much and have a good afternoon. Thank you.
Thank you.